What constitutes child abuse?
This is a very important topic, and this is occurring, unfortunately, all over the world. Every culture, every nation, so I'm really glad we're talking about this topic, and maybe this can help all of us increase our awareness of when a child is being abused. What constitutes child abuse is when there is physical, sexual, or emotional harm upon a child caused by an adult or an older person. When it's caused by a peer of the same age, we don't really call that child abuse. We call that assault. And there are 5 areas of abuse when we break it down: physical abuse, sexual abuse, emotional abuse, neglect, and witnessing domestic violence, since this is part of the topic. Those are the 5 areas where we try to see if a child is undergoing that trauma. And a little bit of description would be this. Physical abuse is when something physically is happening to the child and it is causing injury. Or the physical abuse is also causing emotional injury, and that's just a little bit more complicated. Bruises, cuts, bleeding, broken bones, sometimes to the point of internal organ damage. This is considered physical abuse. And when it's repetitive, perhaps it might not cause injury on the first episode, but is very repetitive to the point of causing emotional abuse, then we consider that physical abuse as well. Some parents utilize spanking, for example, as a physical discipline. And if it's one time in order to reassure or teach safety, we may not call that abuse. But other forms would be considered, especially if they would cause potential harm. Sexual abuse is anything that's related to the sexual organs or the caressing of any part of the body, doesn't have to be sexual organs, that is considered bringing arousal or sexual pleasure to the perpetrator. So even constant caressing of the face, and that's not a sexual organ, but if it is for the purpose of the perpetrator bringing pleasure to him or her, and it causes discomfort in the child, that's considered sexual abuse or molestation. Of course, everyone would agree rape and other types of touching molestation is abuse. But I want to include grabbing of the butt, or caressing the back, or long affectionate hugs. Those are considered sexual abuse to the child. Thirdly is emotional abuse. This one is pretty much very vague for some people, where the older adult or older person is mistreating the child using words or attitudes, and causing the child to feel very devalued, and a constant discouragement over and over again. So emotional abuse is sometimes much more difficult to define that that's happening. But when the child says, my dad's always yelling at me and I just feel like I'm subhuman, I shouldn't have been born, that can be considered emotional abuse, for example. The 4th one is neglect. This is also very important. Neglect is where their basic needs are not being met. Medical care or nutrition, even clothing and shelter, or doing their best for appropriate level of education, whatever is available. That is called neglect. And the last one is witnessing domestic violence. A child is not meant to see their adult loved ones in the home fighting extremely in front of the child. sometimes not even in front of the child, they already have that sense that something is wrong. For example, let's say the mother is, because mother is often a victim, it could happen the other way around too, but let's say the mother is being hit by the father, but the father never hits the mother in front of the child. It's only when the child is at school. But the child can come home and see their bruises and black eyes on the mom, or seeing the mom crying and upset. They can sense that something is happening between the parental relationship. So witnessing or experiencing domestic violence is also considered child abuse.
Does child abuse or domestic violence make children have mental disorders?
If a child has gone through the trauma of abuse, of any of the types that we just talked about, then yes, there is a much higher risk of developing emotional problems and disorders, such as depression, anxiety, even substance abuse later, even medical illnesses. And problems academically, socially can happen. And then in the child's older years, when they're becoming adults, if unprocessed, untreated, then they can have trouble with other relationships and friendships, especially intimate relationships, such as their future boyfriend, girlfriend, fiance, spouse. Closeness and trust can be jeopardized, where they just can't feel they can trust anybody. These things can happen.
What are typical things you see with children who experience child abuse or violence?
Yes, so many. And I'm going to give you 4 categories to keep it organized. And what I tell you, it's not limited to these. I'm just giving you a few examples of each category. For example, emotional problems, anxiety, fear, depression, anger, rage, suicidal ideations. These can occur. Physical problems such as sleep issues, appetite changes, medical illnesses not getting better, and drug and alcohol use and abuse. Behavioral problems can occur, such as aggressive behaviors, self-harming, or increased fighting with other peers, bullying others, and even sexually acting out. That is also something very, very important to pay attention to. And social problems, loss of interest in things they used to enjoy, increased time alone or withdrawing themselves, being isolated, decreased trust, maybe even in the people they used to trust. They fear new relationships and have academic problems or social problems at church or in other social environments. So many things, right?
What can a parent or teacher do for children who have experienced child abuse?
Yes. Well, number 1 is ensure safety. If it's still occurring and you are finding out and it's still happening, then a rescue and extraction might be necessary. So it's okay to ask, is it happening even now or still happening? And then to discover how to keep the child safe. Second is, maybe it stopped happening for a while, like a month or 2. So a crisis plan needs to be in place, because it is very possible to reoccur. And you have to assume that it could and it will reoccur. Also allow the child to experience that you can be a safe space to share what they're going through or what they did go through, because oftentimes they are threatened by the perpetrator. If you share what happened today, then your mom's gonna get hurt or your family's gonna get killed. They will go that far to threaten the child to keep their mouth shut. And so it's very important to share. No one's gonna get hurt. You can share with me. I'm here to help you. Also to reassure them if they're feeling guilty that it's not their fault. Sometimes, for some reason, they think they brought it onto themselves. Or if they don't share, they'll feel guilty if harm came to their family. Also, to seek professional assistance. Sometimes we can't just be the only ones to help the child, but to seek assistance, because early intervention is always the key. A trauma like this, kept inside and buried all the way to adulthood, can you imagine the scars that can go deeper and deeper? And also make sure if there are any injuries to be treated. Sometimes they're hidden. They cover it with their clothes, or if sexual abuse happened, you're not going to know unless you check that area, but you can't check that area. You're not a medical professional. So it's always great to go to a pediatrician and mention how you have suspected that abuse has happened, so that they can do the appropriate assessment. If the ongoing trauma or ongoing abuse is happening and potential harm is there, maybe it's not safe for you to go to the home and try to stop it. Sometimes you would have to call the authorities.
What are typical treatments for children of abuse?
When someone comes to an office like ours, outpatient mental health practice, we do a full evaluation, because many times, even after the trauma event or abuse, we need to find out if they have any other diagnosable problems, such as major depression, anxiety, panic disorder, and PTSD, of course. But also, we must not forget to do a suicidal assessment, because many children feel so hopeless, so shameful after this occurred, that they would rather just disappear and not have to face it anymore, or not to face their parents or their friends that this happened. So we have to rule out suicidal ideations. Then psychotherapy or counseling is very important, because we have to talk about it. They have to actually share exactly what happened, which is very hard to do. But the more they share, then the processing becomes easier and easier. Many children and teens, they'll say, no, I don't want to talk about it. I don't want to relive it. I don't want to get re-traumatized by talking about it. But interestingly, we share and teach them. But by doing that, they can overcome it more and more, and it will not intrude their memory in the future. I always use the splinter analogy, the little small wooden splinter. It has to be taken out, and it hurts a lot when it's coming out. But after it comes out, the healing can really take place. So in psychotherapy or counseling, we have to have them talk about it. And if there are no psychotherapists around and you're willing to listen, you can ensure, and even though you're not a professional, and I have to say this very carefully, you can just ask them the story and promise them that you will keep it to yourself. Then after that, one more thing, some young children can't remember. As a defense mechanism, they can't remember they even got abused or the details. So in therapy, skilled therapists use things such as play therapy, drawing and art therapy, or sand tray therapy, or using the playhouse. Because while in the play session, the reenactment sometimes occurs, and we can discover what may have happened. Another area of treatment is medications, because if other major psychiatric problems are there, major depression, anxiety, panic disorder, like what I mentioned before, sometimes, at least temporarily, these medications are needed so that the hole isn't deeper and deeper in their dysfunction in social life and in their life. And finally, we must include spiritual healing and spiritual approaches, because we're we're not just flesh and bones, right? We have a physical, we're in a physical vessel, and our mind is invisible, but a little bit more tangible. But the least tangible area and the most fundamental is the spirit. And sometimes when this occurs, the enemy uses it to deceive the child or the victim that they're unworthy. That's why that happened to you. Or you must have done something very sinful some time ago, and that's why this is your punishment. All these really horrible lies can occur. So spiritually, we need to remind the child or the individual of their true identity. If they're not saved, to remind them of how they're not unsalvageable. Jesus already died for them, even before they were born, even before this happened. And to make them realize that these are horrible consequences and curses from the original separation from God, and how Jesus' blood was shed to cover and remove all of those sins and to free them from this captivity that we have. And unless we get filled with that understanding of the good news of Jesus, the trauma memory and all the other subsequent symptoms can continue to entrap the victim. And so we can share with them how in Jesus we have that freedom. Now we have to really understand what that means. Also, afterwards, it's not just going to go away, right? The struggle will be there. And this is an opportunity to teach the child what a spiritual battle means. And it's not with a real gun or a real knife and sword, but to use the Word of God to plant that inside and to realize, you know what, unfortunately, this will follow you in your memories, but the more and more you understand how to use the full armor of God, then the enemy can't attack you as much. So let's learn about that armor of God. So that's one way of really empowering the child or the victim.
Do you have anything to share for those who, as adults, have experienced child abuse as a child?
Yes. Well, first of all, I want to say I'm very sorry that that had happened to you, and you did not deserve that. The one that hurt you is the one to blame. In case any of you feel that you brought it on or you deserved it, that's not true. What I say is you were a victim, and you had to carry that for so long, possibly without an opportunity to share with anybody or to receive comfort from anyone, because maybe the perpetrator was your own parent. And now you're learning about this topic to help other children. It is important to first be aware that you were a victim, and to say to yourself, I was a victim of child abuse, and this is what happened. So it's not, even though it might be difficult, it's not wrong to recollect it. Some people feel embarrassed to talk about it with someone. Oh, because it happened so long ago, I should be over it by now. And actually, no. Sometimes talking about it over and over again is a healing process, and discovering your realizations of what you were thinking back then, what you were feeling back then, the consequential emotions afterwards as you're growing up, how it affected your relationships as you're growing up. It's good to discover what it did and to have a chance to reverse it. For example, one very common consequence is affecting the self-esteem and self-worth. Many men and women who've been abused have a lot of self-doubt, and they cannot face new things with confidence. So if this is a result from the childhood abuse, it's good to connect those two things and to begin fighting even now. It's never too late to find healing and put more and more healing balm onto that wound, so that that wound is not going to be a barrier for you from here on out. And can you imagine if you knew what you went through? You know exactly, and you can empathize with a child who's going through that right now. You can connect with that child, but yet not feel so affected emotionally. So a thought I had in mind is, I'm not sure if you're willing to do therapy or counseling with a professional now, but maybe you did find someone else who went through that as well, and to have a small support fellowship group, and to talk about with each other what you went through, and to comfort one another. Let's not be ashamed of it. It's a history that happened. What can I learn from it? How can I apply the Word of God to it? And also one more thing is, a lot of people, a lot of Christians grow up feeling pressure to forgive the perpetrator. And forgiving and loving back the perpetrator is not the same thing. You can forgive and not like the person. You can forgive and not ever see the person again. Forgiving means not holding that person, not putting it against that person anymore, and giving them power to let it bother you anymore. But that doesn't mean you have to go be best friends. Yeah. So I just want to clarify again how some people struggle with that concept as well. One final thing I want to say is, we were all born broken. We were all born separated from God and broken people. The shalom that we were supposed to have was not there. Shalom means being whole and being complete. When it comes to child abuse or any kind of abuse, the person feels broken. So when we realize how the gospel, how in Jesus, who was our Christ, made us whole again and restored that shalom, that is perfected. Even if my body or my mind or my sexual being was abused, that does not define that I'm broken still. It means spiritually in Jesus, I am whole. And I think we need to really focus on that spiritual wholeness that we are, and how we are already a perfect, precious child of God in His eyes.